Hi guys, my name is Sochinski and I'll be giving my presentation on eating disorder therapists. So, job duties. The number one job duty of an eating disorder therapist is to help their patients through eating disorder recovery. These eating disorders include, but are not limited to, anorexia nervosa, binge eating disorder, orthorexia, avoidant restrictive food intake disorder, and bulimia nervosa. So, how is this done? Helping patients through eating disorder recovery is done by meeting with new patients to understand their needs and therefore create a personalized treatment plan and goal, meet with established patients to track their progress and continue working on their treatment plans via therapy and quote-unquote homework. If an eating disorder therapist works at an inpatient clinic, they will assist in their patient's discharge planning. If the eating disorder therapist will be conducting group therapy sessions, they must develop plans and goals for group therapy. Lastly, they must keep in communication with their patients' doctors and other specialists, such as dietitians, to ensure the treatment plan is actually benefiting the patient. Okay, so required education. While there's not just one path to become an eating disorders therapist, all must have a bachelor's degree. And ideally, the bachelor's degree would be in psychology or social work or human services. On top of this, if you haven't already finished your bachelor's, make sure to prioritize classes that go over topics such as abnormal psychology, body image, and therapy methods. Once you have your bachelor's degree, there are 4 different path options you can choose depending on what sounds right for you and your goals. First, you can get a master's in psychology. Second, you can get a PhD or PsyD in psychology. A PhD often involves more research and a PsyD often involves more clinical work, but it's important to note that most PhD and PsyD programs require a master's degree for admission. Thirdly, you can get a master's degree in social work or human services. Some programs don't require applicants to have a bachelor's degree in social work to be admitted. Lastly, you can get your master's degree in counseling. A popular option here is to get a degree in clinical mental health counseling. But regardless of the school that you pick, you should pick a school that is CACREP accredited because it ensures that the program has been evaluated and meets strict standards set by the profession, in this case of counseling. Regardless of the path you choose to go down, prioritize programs that offer course and/or coursework related to eating disorders and grant opportunities to complete clinical internships in settings where eating disorders are treated. Okay, so licensure and certifications and training. There are no states that require a specific eating disorder therapy license, but all states do require that practicing eating disorder therapists must be either licensed psychologists, clinical social workers, or professional counselors. There is what is known as the International Association of Eating Disorders Professionals, and they offer a number of certifications for different types of eating disorder therapists. In order to gain one of the certified eating disorder specialist certifications, therapists must complete 2,500 hours of supervised care, complete a 1,500 word case study, and pass 4 exams. This certification is worth it because there just aren't many colleges that offer degrees with a focus on eating disorders. So the certification ensures that you have the specific and important training to become a competent eating disorder therapist. And therapists in general must acquire licensing that allows them to professionally practice as a professional counselor. And the license you obtain varies state by state. You can get 2 licenses to practice in 2 states. If you're moving, you can get a license for that state, so on and so forth. But when it comes to training, there are many modalities of therapy that are beneficial in treating eating disorders. One considering this career should become trained in one or more of the following modalities. First and foremost, there is family-based therapy. This is the most successful modality for treating eating disorders in children and teens with eating disorders, so it is recommended that you are trained in it. Next is cognitive and dialectical behavioral therapy. These are both really common modalities, and it's pretty useful in treating eating disorders, so recommend that you get trained in those are also probably the most common. And then another one that I found is acceptance and commitment therapy. This modality is centered on the individual to stop denying and avoiding their inner emotions. Okay, so next are potential job risks. And the potential risks of this job mostly lay on the same plane as the risks for therapists in general. But the first one that I'd like to mention is burnout. Burnout is a huge risk in this profession. This is when a therapist is faced with chronic stressors every day. Without a chance to rest, they begin to shut down. And along with burnout, compassion fatigue is also a risk. When you feel like you have no more empathy left to give, it's very likely that you are or will experience burnout. Vicarious trauma is another risk. This is a result of being exposed to patients' traumatic stories, which leaves an emotional residue on the therapist. There's a vicarious trauma toolkit individuals who are susceptible to it can utilize to address the impact of it and how to sustain their well-being when exposed to it. This is also something that practices and companies can utilize for their employees as well. The interaction between personal stress and work stress is when work stress can heighten one's personal stress and vice versa. This is yet another factor that leaves one susceptible to burnout. Um, Changing standards in the specialization can become a risk because as of right now, there's not many who specialize in eating disorders. So as the job numbers rise, it's very likely that standards will change. And this could mean, for example, that there's a new required license that you must obtain. Um, in regards to eating disorder therapists specifically, there may be disagreement between the therapist and the therapist team. So, for example, there may be a disagreement between the therapist and the patient's dietitian. This could be when the dietitian may be recommending the patient begin to start eating their favorite foods way too soon in the treatment plan. Lastly, there are many different ethical dilemmas. These can range from the standard ethical dilemmas like abstaining from sexual relationships with client to like client confidentiality. And then this can also mean whether or not someone should self-disclose to their client about their personal history with eating disorders. And it could also be one's personal biases about what eating disorders look like influencing how you treat a patient. Okay, but now let's talk about the potential job rewards. So while there are many different job rewards based on individuals' values and the workplace that they are in, here are some that are commonplace. First and foremost, job satisfaction is a huge possible reward. This is a job that has a direct impact on someone's well-being and recovery. And if you're passionate about helping people, it's almost guaranteed that you will have job satisfaction, or at least a very high level of job satisfaction. Next, there's a big chance for autonomy. Depending on the specific practice you choose to work for, or if you even start your own practice, it's very likely that you'll be able to make your own schedule. This allows for time off to lessen the chances of burnout, and it can also help keep your heart in your career. Next, the average salary for an eating disorders therapist is $77,000 a year. I did find quite a bit of discrepancies in what the average salary is, but this seems like the most accurate. Like it went down to 40,000 and up to like 120,000. So I think 77 was probably the most accurate here. But of course, the salary depends on experience, but you're guaranteed a living wage regardless. And so this ensures you have financial security, which is a huge aspect to job satisfaction. Um, the therapeutic relationship is another possible reward. As we know, when a patient fully opens up to you and there's an emotional connection, the patient's growth becomes exponential. And this can just be really rewarding for a therapist to see and knowing that they created an environment that allowed that growth. And lastly, growth. Whether it be professional growth, patient growth, or practice growth, all contribute to our rewards as a therapist. We all want to see what we're doing grow and thrive. So that is definitely another reward. Um, Expected job outlook. Given that eating disorders affect 9% of the global population, and also 9% of the United States population will have or experience an eating disorder in their lifetime, there will always be a need for therapists who specialize in eating disorders. And something cool, the job outlook for eating disorder therapists is 22% between now and 2028. So the need for eating disorder therapists is growing, therefore there will be more job openings. And I think this is very important because I think that there needs to be more specialization within the field of eating disorders. But yeah, that was my presentation on eating disorder therapists. Thank you for watching and listening. And yeah, thank you so much. Bye bye.